Good evening, everyone. It's a privilege to welcome all of you to this session being held as a part of the CPR Awareness Week observed from 13th to 17th October by Ministry of Health and Family Welfare. This initiative carries a vital message that every individual can make a difference in saving life. CPR is a simple yet powerful intervention that sustains life until professional medical help arrives. Building on this awareness and skills across community is a crucial step towards a more responsive and a compassionate society. We hope that today's session gives you a little bit more information on this very vital topic. We are honored to have among us Dr. Rakesh Gupta, President and Director of Public Health at Sipher, Dr. Shivdular Singh Sibia, who's a cardiologist from Sibia Medical Centre, Dr. Keerat Sibia, a pulmonologist, and Mr. Shivdular Singh Dhillon, who's the Secretary and Chief Executive from Punjab State Red Cross Society. I'm sure their leadership and contributions to public health continue to inspire us all. I thank each and every one of you for joining today's session and for being a part of this collective effort to strengthen the community health and emergency preparedness. I'm sure and very confident that today's discussion will deepen our understanding and reinforce our shared responsibility to act when every second counts. So with this, I would request Dr. Rakesh Gupta, sir, if you can take your session on giving an overview of CPR. Sir, you're muted. Dr. Rakesh, sir, you're muted, sir. If you can unmute yourself.
Okay, just show the slides, please.
Yeah, just give me a second.
And after my presentation, you can have snapshot.
Right,
Or
sir.
before that also. Before that also, it's okay.
We can do it now, sir, if you want.
Yeah.
Okay. So in that case, I would request everyone to please switch on your cameras and show your beautiful faces so we can take a good group photograph to commemorate this occasion. All right. So on the count of three, everyone give their bright smiles. 1, 2, 3. So I'll just take one more. 1, 2, 3, smile. Great. Take the pictures. So I'll just share your slides.
Yeah.
Is it visible, sir?
Yeah, it is visible.
Yeah. Over to you, sir.
Yeah. So I'll be talking, giving just an overview of the cardiopulmonary resuscitation. It is CPR. It is popularly called as CPR. And as Paridhi told you that it is a life-saving technique that helps maintain blood flow in the brain and the vital organs when our heart stops. To promote awareness and build life-saving skills, the Ministry of Health and Family Welfare is observing CPR Awareness Week from 13th to 17th October. And sessions will help the participants understand the importance of CPR, emergency response steps, and how to perform compression only CPR correctly. And the benefits of joining is that we will acquire essential life saving skills in cardiac emergencies, and it will contribute to strengthening community health and safety. Next, please. So I think we should take the pledge to save a life. Next, please. I'll just read out the pledge for you, and you can just download when you get the recording of this webinar. So CPR जागरूकता सप्ताह अक्टूबर 2025 में मैं सत्यनिष्ठा से प्रतिज्ञा करता हूं या करती हूं कि मैं अचानक हृदय संबंधित आपात स्थितियों के दौरान जीवन बचाने में समय पर कार्डियोपल्मोनरी रिससिटेशन के महत्व को समझूंगा। मैं सीपीआर की सही तकनीकों को सीखने और उनका अभ्यास करने और उनसे खुद को अपडेट करने का प्रयास करूंगा। मैं स्वास्थ्य संबंधी आपात स्थितियों में लोगों की मदद करने का प्रयास करूंगा और पेशेवर चिकित्सा स्वास्थ्य सहायता आने तक साहस, करुणा और जिम्मेवारी के साथ सहायता प्रदान करूंगा। मैं अपने परिवार, दोस्तों, सहकर्मियों और समुदाय के सदस्यों को सीपीआर और उनके जीवन रक्षक क्षमता के बारे में जागरूक होने के लिए प्रोत्साहित करूंगा। मैं मानव जीवन और गरिमा का सम्मान करूंगा और एक ऐसे समाज के निर्माण के लिए प्रतिबद्ध रहूंगा जहां पर हर कोई चिकित्सा आपात स्थितियों का आत्मविश्वास के साथ जवाब देने में सक्षम हो। मैं जागरूकता, प्रशिक्षण और तैयारी गतिविधियों का सक्रिय रूप में समर्थन करूंगा जो सुरक्षित और स्वस्थ समुदायों का निर्माण करता है। इस प्रतिज्ञा के साथ मैं एक जिम्मेवार और तैयार नागरिक बनने के लिए प्रतिबद्ध हूँ। हर पल महत्वपूर्ण होने पर एक जीवन बचाने के लिए तैयार। थैंक यू। So our chief
Right.
guest is also with us. So good evening, sir.
Good evening, sir, and welcome to today's session. We are really honored that you could join us. Uh, is Dr. Kirti here, or should I move to the next session?
Keerat. She's Keerat.
Kirat, sorry. Yeah, I apologize for this.
No,
Uh,
no, no.
yeah, I
I think
think.
Dr. Sibia
Good
can.
Oh
evening.
yeah.
Yeah, yeah.
Oh
Okay.
yes.
Good
Yeah.
Dr.
evening, but I think it will take some time for me to set up my system. Could you please continue with the next session, then I'll just join in.
Right.
Okay, okay,
So
okay.
we will move on to the release of the book, sir, if that's fine.
Yeah.
All right. So I'll just share my screen again. And we have a very special event also. We'll be releasing the book on Save the Heart, Stop Killing Yourself. It is written by Dr. Rakesh sir, Dr. Sibia, and Dr. Keerat Sibia, ma'am. So I will just uh, yes,
So you can
yes.
show up the slides after Dr. Sibia's presentation.
Okay. So so if you can just release, then I can actually move to the next slide.
So
Since we're cutting the ribbon
he'll
and
be
everything.
giving some overview of
Overview
the
as
book
well.
also.
All
Yeah.
right. All right. So should I stop sharing, sir? Will you be
Yeah, yeah.
sharing the screen? Yeah. So okay. So
Has he been allowed to share the
yeah.
slides?
Yes, yes, he
Okay.
has. He has. I would now like to invite Dr. Sukhbinder Sibia, sir, for your talk. I've given you the access.
Are the slides visible?
No, they are not. They are not.
They're not. They're not.
Yeah, now it is visible.
So you
Yeah,
can
yeah.
go full. Yeah.
Yeah, make it full screen.
Yeah.
Right.
Is it okay?
Yes,
Yeah,
sir. We can see the screen.
Right,
Yeah.
right. So we are in a position where we have to have a movement to protect the heart from the next global epidemic. That is the epidemic of nicotine. When I'm talking about nicotine, I mean all forms. It's not just the pouch. The pouch is what is now coming up. But when I talk about nicotine, I mean all types of nicotine, not just limited to the pouch. Although this book is mainly for the pouch, but it includes everything. First of all, thank you very much, Mr. Preeti Sudan, a retired senior IAS officer, former chairperson of the UPSC, and Health Secretary of India for writing a beautiful foreword for this book. It is very encouraging when we have a foreword by such a senior, well-known forward-thinking person. Thank you very much, madam. This is basically a book written by 3 doctors having one mission. The mission is a nicotine-free, heart-safe future. Dr. Keerat, she is a pulmonologist, critical care specialist who advocates for lung and heart health. And she's the one who actually looks into the lungs, especially when we are talking about nicotine from smoking, and sees the effect of the smoke on the bronchus, on the inside the lungs, which we are not able to see from outside. So she's able to understand this whole topic much better than us. And Dr. Rakesh Gupta, my old friend, I know him for, I think, more than 35 years now, maybe 40 years. His dedication to this cause is really remarkable. And understanding is great in this. When this e-cigarettes came up, I was actually thinking, I was made to believe by the manufacturer that it's a step towards tobacco cessation, towards tapering off the tobacco from the people who are using it. And he's the one who showed me that no, this is another gimmick of the tobacco industry, and we should not let this happen, that we all fall into this trap. And I'm director of Sibia Medical Centre. I've been associated with Dr. Rakesh since decades. I'm also president of the International ECP Association, and I'm a pioneer in preventing and reversing heart disease without surgery. We introduced ECP, ESMR, ACT, etc. in this region. And Dr. Rakesh is the one who actually motivated me into going into that field. When he got me literature that his sister had sent from UK about chelation therapy. That was right in around 1993-94. That is where my whole journey towards non-invasive cardiology started. Now, why is this book important and why now? It is because of the rapidly rising nicotine pouch use among the youth, misleading marketing, we'll come to that also. And when we say tobacco-free, it does not mean safe. It does not mean nicotine-free, it is tobacco-free. And this actually misguides a lot of us. And because of the rapid rise, because of misleading marketing, it is time to act before it becomes too late and before we fall into this trap of and get into this epidemic. What the book reveals is, starting from what is nicotine, etc., then it is what happens as soon as you put the pouch content under our lips. The nicotine is released into saliva. It is absorbed through the mucus, goes into a bloodstream, and reaches the brain, where it activates the nicotine acetylcholine receptors and gives us a feel-good feeling. And this feel-good feeling is the one that we want. We always desire to feel good. We desire to feel happy. And this is what initially this nicotine does to us. And once we have that happy feeling, we want more and more of it. And our cells, our neurons get used to it. They crave for more pleasure. And first of all, it is willpower which stops us from taking nicotine or any other addiction. And after that, willpower is no more important. It is the chemistry which is forcing the users to carry on taking the addicting substance.
Dr. Sibia, you can skip the details. Let the people read the book right now.
No, I'll skip the details, very, very short.
Okay. Thank you.
But nicotine is still damaging. And what is important is to realize, like in treadmill test, we are walking on the treadmill. And the heart rate increases, the blood pressure increases. And the same thing happens when we take nicotine, except that when we are doing the treadmill test, the blood vessels dilate. But in this case, they don't dilate, they constrict. So the demand is increased and the supply of blood is decreased, and that is what leads to angina and heart attack. So it is very important to understand this, that this good feel-good factor is actually harmful to us. And it leads to blood pressure, atherosclerosis, heart attack, stroke, and in the mouth, it also leads to gum recession, tooth loss, oral cancer. And so nicotine is a all-round winner in the wrong direction. And we have to move forward. And for that, knowledge, awareness, action, and protection is required. And this knowledge and awareness is the idea of having this book. The key takeaway from the book are what nicotine pouches are, why they are spreading so fast, how nicotine stresses the heart and circulation, the long-term cardiovascular harms, why youth are at greater risk, the industry's tactics of deception to sell more and more of their products, what science, doctors, and policy already know, the policy makers, and most important, what can be done. So we have to do something to save the heart and stop the epidemic. For more information, there are a lot of tobacco cessation clinics. They can be attended. Dr. Keerat is also organizing those at her own level. In clinic, there are a lot of people who want to leave this habit of smoking or pouches and all forms of nicotine use. But they don't want to be exposed. For that, online tobacco cessation coaching is available, and which can be done sitting in one place. You can handle patients worldwide. Then free lectures, free talks, podcasts, ebooks, they are all what is possible. So let us save the heart, stop killing yourself. The next epidemic can be prevented if we act now. Thank you. Thank you.
Thank you, Dr. Sibia. Thank you.
Thank you, sir, for giving a brief overview about the book. I'm sure it'll be an important read for everyone who's dealing in this field. Thank you. So we will be going to release the book, or should I go?
Yeah. No. We can release the book. So
Right.
Chief Guest has already joined us.
Yeah. So I would request all our esteemed guests to please release the book. Dr.
Anji,
Sibia,
sir.
you will have to stop sharing from your end.
Right.
Yeah. I would also invite Dr. Dhillon, who's the from Punjab Red Cross, to also join us.
He's already joined. Yeah.
He's already joined. All right.
Yeah.
I'm already here, and it's such a pleasure. I'm sorry, I'm traveling right now, so I might not be very properly visible because I'm just switched on the car lights. But it's such a pleasure to release this book, and I'm sure this book will stand in good stead to all those people who are at risk from this upcoming epidemic of the nicotine pouches.
Yeah.
My best wishes to Dr. Sibia, and we hereby release this book.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Yeah.
So the book is released. Yeah.
Yeah.
So I may tell you that this is available to read on Kindle. That is free of cost.
Right. So I would now like to call Dr. Keerat Sibia, who's a pulmonologist from Sibia Medical Centre, to please give her talk on cardiopulmonary resuscitation, what everyone must know. Ma'am, over to you. I hope you can, you can share your screen. Yeah.
Hello. Good evening, everybody. And
Keerat, can you make it slideshow mode?
This is
Can you make it slideshow mode?
I'll do that. Slideshow.
Yeah.
So before we start talking about CPR, that is cardiopulmonary resuscitation, and every one of you would have heard about CPR at some point of time. I'm going to talk about CPR and I'm going to start using some terminology in terms of the common language. I'm going to speak in Punjabi and Hindi as well. CPR के बारे में सबने कहीं ना कहीं सुना ही होगा कि दिल की धड़कन रुक गई, या फिर हॉस्पिटल में जब पेशेंट बहुत सिक हो गया, एकदम से उन्होंने बोला कि पेशेंट बीमार हो गया, दिल की धड़कन रुक गई है, तो उन्होंने देखा कि पेशेंट्स को ना वो डॉक्टर्स जोर जोर से दबा रहे थे। तो एक कॉमन धारणा है कि सीपीआर होता है, पता नहीं इफेक्टिव होता है कि नहीं होता है। And the first thing I want you to all note down today and be more and more aware regarding CPR is that one, it is effective. It can be life-saving. Number two, no, you don't have to be a doctor to do a CPR. Number three, any CPR is better than no CPR. अगर आपको लगेगा मुझे तो करना नहीं आता अच्छे से, मैं कोई नुकसान ही ना कर दूं, तो वो नुकसान ना हो उसके लिए we will teach you today. And some very basic things एक बार सीख लेंगे तो हमेशा जिंदगी में आपके साथ चलेगी ये चीज, और भगवान ना करे ऐसा कभी आपके सामने कोई सिचुएशन आए, बट अगर ऐसी सिचुएशन आती है तो यू कैन बी एक्चुअली, यू डोंट हैव टू बी अ सुपरमैन और अ सुपर हीरो टू सेव अ लाइफ. यू नो सीपीआर, यू कैन एक्चुअली सेव अ लाइफ. नाउ अगर आपको पता हो करना क्या है, क्या आप करेंगे? ऑफ कोर्स आप करेंगे. हमारा बेसिक ह्यूमन नेचर होता है, हमारा बेसिक ह्यूमन इंस्टिंक्ट है. Ultimately, we are here to help someone and live our life. That's it. That's the bottom line. So, hello everyone. I am Dr. Keerat Sibia. I am North Zone Governor for the Chest Council of India. I am consultant pulmonology and critical care. Basically, I'm a chest specialist and I specialize in critical care. जो बहुत sick तरह के patients होते हैं, गंभीर रूप से बीमार patients होते हैं. We get those kind of patients from all over the 3 states of Punjab, Haryana, Himachal, even from Jammu Kashmir. So CPR or cardiopulmonary resuscitation क्या चीज है? It's an emergency situation में, emergency में एक treatment होता है. Rather, it's a technique which when you do, when somebody has stopped breathing या फिर उनका heartbeat रुक गया. फॉर एग्जाम्पल, किसी को आपके सामने हार्ट अटैक हो जाए, या कोई एकदम से कोई पानी में डूब रहा है, आपने उनको बाहर निकाला, तो उसके बाद नेक्स्ट क्या करना है? सो सीपीआर कैन सेव अ लाइफ, बट इन व्हाट सिचुएशंस यू शुड नो दैट. एट द एंड ऑफ दिस वेबिनार आपको 2 चीजें याद रखनी है. पुश हार्ड, पुश फास्ट. बस. इमरजेंसी में ना बहुत ज्यादा चीजें आपने अगर रिहर्स ना की हो, आपने पहले प्रैक्टिस ना की हो, तो एकदम दिमाग में आती नहीं है. पर अगर आप इतना याद रखें कि यू हैव टू पुश पुश पुश, push hard, push fast on the chest, that can be just enough to save a life. तो जब हम पुश करते हैं, हम चेस्ट को दबाते हैं, उसको हम कंप्रेशंस कहते हैं. एंड hands only CPR is CPR where you are only pushing compressions and pushing compressions on the chest. Okay, so आपको कैसे पता चलेगा that this is the place where you should be doing a CPR? Let's say आप वॉक कर रहे थे, आप गार्डन में जा रहे थे, या आप रोज गार्डन घूम रहे थे. वहां पे आपने देखा कि कोई somebody is on the lawn, कोई लेटा हुआ है, और आपको लगा कि oh, this person is unconscious, this person needs help. क्या आपको CPR शुरू कर देना चाहिए? We have how many people today in the audience? We have nearly 95 people in the audience today.
No, ma'am.
So, क्या हमें CPR शुरू करना चाहिए?
No, ma'am.
Okay, so पहले क्या करना चाहिए? First, we should see is the person responsive or not. आपको पूछना पड़ेगा, hello, how are you? या फिर पापा जी ठीक हो? उन्होंने हिला के पूछो. For all you know, that person might be just lying in the sun, या वो पिकनिक पे आए थे, वहां लेट गए, थक गए, तो he was just enjoying the sun or the good weather, and आप उनको एकदम से CPR शुरू कर दें, ऐसा नहीं है, है ना? Second is the person safe? कहीं आग लगी है, somebody is unconscious. Before you think of CPR, you have to be safe and that person has to be out of danger. So you move that person from that area where the fire is there, smoke is there, because smoke inhalation injury is also a very serious concern. It's not just the fire and the burns. You move that person to a safe area, and then you will ask the person, are you okay? So you have to assess consciousness hai ke nahi hai. Agar nahi hai, तो yes, you have to start CPR. Before you start CPR, you have to understand that CPR में जोर लगता है. It's not कि हल्के हल्के से आपने दबाया तो दिल की धड़कन चल पड़ेगा, दिल को सपोर्ट मिल जाएगा. क्योंकि CPR में आपको जब कंप्रेशन देना है, आपको इतना जोर देना पड़ेगा में जो ब्लड है वो पंप करके पूरी बॉडी में सर्कुलेट करे. आपने बॉडी की सर्कुलेशन को सपोर्ट करना है, तो आपको आपका काफी जोर लगता है. उसका टेक्निक क्या है वो मैं आपको बताऊंगी. बट वाई आई एम टेलिंग यू कि जोर लगता है, इट मीन्स ऐसा नहीं कि CPR शुरू कर दिया और आप 4 घंटे तक कर लोगे या 1 घंटे तक कर लोगे या 20 मिनट तक अकेले कर पाओगे. इट्स नॉट इजी. सो यू हैव टू मेक श्योर, फर्स्ट थिंग टू डू इज, आपने देखा कि कोई है patient who probably needs CPR, who's not responsive. Before you do anything else, you call for help. You can call emergency services अगर आप अकेले हैं. अगर आपके साथ कोई है तो please tell them कि call for help. आप जा रहे थे, आपको कोई मिल गया who's unconscious, who needs help. आपके साथ जो passerby है, call services. Next, if you are alone, you call yourself. First, call emergency. 108 is the emergency number for India. And in the meanwhile, you start CPR immediately. अब CPR शुरू करने से पहले क्या करना है? सबसे पहले the person जिनका आपने CPR शुरू करना है, जिनको आपने life support देना है, उनको that person should be on a flat surface. उबड़ खाबड़ टेढ़ा मेढ़ा कोई होगा तो आप CPR नहीं कर पाएंगे. तो person has to be on a straight flat surface. Second, आपने पल्स देखनी है. पल्स यहाँ नहीं देखना है, यहाँ देखना है. नेक की पल्स, कैरोटिड पल्स अगर आप देख सकते हैं तो. अगर आपको लगता है कि आपने नॉर्मल कभी जिंदगी में पल्स देखा है, तभी आपको पता लगेगा कि उस पॉइंट पे कि पल्स है कि नहीं है. दूसरा, ब्रीदिंग. इज द पर्सन ब्रीदिंग और नॉट? ये तो आप देख ही सकते हैं, राइट, कि सांस ले रहे हैं कि नहीं. अगर पल्स नहीं है, पर्सन इज नॉट ब्रीदिंग, आप 10 सेकेंड के लिए दे से यू शुड चेक. लेकिन अगर आपने पहले कभी ध्यान से पल्स नहीं चेक किया है, ब्रीदिंग आप थोड़ा सा देख सकते हैं, तो टाइम खराब नहीं करना है. आपने बस CPR शुरू कर देना. CPR 30 कंप्रेशन, उसके बाद 2 रेस्क्यू ब्रेथ्स, ये स्टैंडर्ड रहता है. क्योंकि हम जब कंप्रेशन दे रहे हैं, वी आर सपोर्टिंग द हार्ट एंड द सर्कुलेशन. एंड जब हम ब्रेथ दे रहे हैं, तब हम लंग्स को ऑक्सीजनेट कर. बट इसको भी मैं सिंप्लीफाई करूंगी. अब ये कंप्रेशन और ब्रेथ को के बारे में सोच के डरना नहीं है, इसको बहुत सिंप्लीफाई करेंगे हम. रिमेंबर CAB. इसको बचाना है तो क्या करना है? गाड़ी में बिठाना है, कैब में बिठाना है, एम्बुलेंस वो कैब है उसके लिए फोन करना है, हेल्प को बुलाना है, और CAB को याद रखना है. कैब इज नंबर 1 कंप्रेशंस, नंबर 2 एयरवे, एंड नंबर 3 ब्रीदिंग. इसमें क्या रहेगा? नंबर 1 कंप्रेशन, जैसे कि मैंने बताया कि आपने जब कंप्रेशन देना है, आपने हाथ को पुश करना है, दबाना है, उससे सर्कुलेशन रहेगा. अगर बॉडी में सर्कुलेशन नहीं जाएगा, ब्लड मूव नहीं करेगा, तो टिश्यू विल स्टार्ट डाइंग. So the technique to do CPR is the most important thing that we need to learn today. आपने पेशेंट के या जो पर्सन हु इज नॉट रिस्पॉन्सिव, उनके सेंटर ऑफ द चेस्ट उनका कहाँ रहेगा? दैट विल बी बिटवीन द निपल्स. आपने हाथ दोनों क्रॉस करने. सी, दोनों हाथ लिए, एक के ऊपर दूसरा हाथ लिया और एक हाथ को बंद कर लिया. दूसरे को भी कर सकते हो, पर नहीं तो ऐसे भी कर सकते हो. एंड देन विद दिस पाम, जो आपका पाम वाला एरिया है, इसके साथ अपने सेंटर में पुश करना है, जहाँ पे सेंट्रल बोन रहता है, स्टर्नम रहता है, उस पॉइंट पे आप प्रेस करेंगे. एंड व्हेन यू डू दैट, आपकी बाजू बिल्कुल स्ट्रेट रहनी चाहिए. और जब आप फोटो देखिए यहाँ पे, the person who's giving the compression, the shoulders of that person, the arms have to be straight and the shoulders have to be right above the hands. जहां हाथ नीचे हैं, शोल्डर बिल्कुल स्ट्रेट ऊपर आपके आएंगे, और आप नीचे अपनी बॉडी के वजन से कंप्रेशंस देंगे. लाइक आई सेड, बहुत जोर लगता है जब आप CPR करते हैं. So using your own body weight, push straight down on the chest. आप जब चेस्ट को पुश करेंगे, about 5 centimeter या even up to 6 centimeter तक you can compress, but not more than that. Push hard, push fast for 100 to 120 compressions per minute. ये कहने का मतलब ये है जब आप compressions करेंगे ना काउंट करेंगे 1 2 3 4 5. That's how you know कि you are giving compressions or CPR at a good rate. अगर कम रहेगा it will not be enough to maintain circulation. अगर आपकी position सही नहीं होगी, position में क्या रहेगा? Hands clasped and locked. Clasp your hands and lock them. Arms straight and shoulder right above the point जहाँ पे हाथ से आप दबा रहे हैं. Shoulders right above the hands and push with your entire body. So another thing I want you to see है, देखिए जो पिक्चर यहाँ पे आपको दिखाई दे रही है, this lady who's pushing वजन के साथ, उसका बॉडी का वजन ऊपर इसीलिए आ पा रहा है क्योंकि she is at the level of the patient and उसकी legs fold करके, she is on her legs fold करके, she is putting her body weight on the body. So after 30 compressions, 30 बार आपने compression जब दिए, उसके बाद what we want to do, ideally आपको airway support करना चाहिए. उसके लिए क्या करना है, अपना जो palm है person के forehead पे रख के tilt करना है head पीछे, and with the other hand you have to lift the chin forward to open the airway. So this is the head tilt chin lift maneuver, and you press the nostrils of the जो person है, you press the nostrils shut and you give mouth to mouth breathing. अगर आप directly नहीं देना चाहते, you can put a handkerchief और उसके ऊपर से you can give that. अगर आप comfortable नहीं हैं, आपको लगता है कि this person is unknown और आप breath नहीं देना चाह रहे या आपको hesitation है, just compressions भी करते रहेंगे, even that can itself be a big savior. आज के जमाने में क्या कहीं माउथ टू माउथ ब्रीदिंग दिया जाता है? इज इट रियलिस्टिक? हॉस्पिटल्स में तो नहीं देते हैं. वी हैव इंटरफेसेस जिसके साथ हम ब्रेथ्स देते हैं. आई विल गिव यू वन लाइफ एग्जांपल. Have a family friend. He had a heart attack. He had a cardiac arrest when he was at home. उनकी वाइफ ने आइडेंटिफाई किया, वाइफ को CPR आता था, उन्होंने कंप्रेशंस शुरू किए, ब्रेथ्स भी दिए. डॉटर ने एम्बुलेंस को बुलाया, वाइफ और डॉटर ने 30 मिनट तक CPR दिया ऑल्टरनेट करके. When one person was giving the compressions, the other person was giving a breath. कि अच्छा 30. इसका क्या सिस्टम रहेगा? एक बार आप 30 compressions दिए, दूसरे बंदे ने ब्रेथ दिया, फिर आपने 30 compressions दिए, दूसरे ने ब्रेथ दिया. 5 बार आप 30 के compressions दे रहे हो और हर बार के बाद 2 breaths दिए जा रहे हो. फिर दूसरा बंदा कंप्रेशंस देना शुरू कर देता है और आप ब्रेथ दे सकते हैं. सो दैट्स हाउ शी वाज एबल टू सेव हर फादर. 20 minutes of CPR, उतने में टीम आ गई, दे टुक ओवर एंड ही सर्वाइव्ड एंड ही स्टिल लिविंग. ये बात को ऑलमोस्ट आई थिंक 2-3 साल हो गए. So this is how remarkable CPR can be. It is not something you just read in the books or you see in the movies. It actually works. You have to make that effort to learn it and do it in emergency. So if you're not trained or if you're in doubt, you don't want to put your mouth to the person's mouth, please do a hands only CPR. Give 30 or if you have the option of giving a breath, then 30 compressions and then 2 rescue breaths. So chest compressions, remember, push hard, push fast, and has to be done at like 100 to 120 times per minute. Continue chest compressions until there are signs of improvement. जब तक आपको ना लगे कि improvement आ गई है, तब तक आप continue कीजिए, या फिर team आ जाए to help, तब तक you can continue compressions. So if you're afraid, आपको डर लग रहा है कि मैं CPR करूं, कोई दिक्कत तो नहीं हो जाएगा, कोई और नुकसान तो नहीं हो जाएगा, प्लीज अंडरस्टैंड, या शायद मुझे अच्छे से नहीं आता है तो उसका क्या फायदा, अच्छे से ना करने से तो अच्छा मैं ना ही करूं. No. Any CPR is better than no CPR. Bad CPR is better than no CPR. So learning CPR, I personally feel even children who are say 13 or 14 years old, they should start learning. And the difference between doing something and not doing something is it's a matter of life and death. And I want to thank you all for coming here today to learn, to make an effort to save a life. Thank you so much for having me here today as well.
Thank you. Thank you, Dr. Keerat.
Thank you, ma'am, for giving this very important presentation. And I'm sure we have learned a lot. Uh, if we have any quick questions for ma'am.
Yes, Dr. Keerat, a big blow. I mean, if you don't know CPR, a big blow to the middle of the chest will be okay. I mean, if you don't know about the CPR. But we were told, we were told that way when we were in house job. Hello.
No, could you like repeat the question?
Okay. A big blow in the middle of the chest would be okay if you don't know CPR.
If you give a big blow in the middle of the chest, mukka marenge, it will not help. It will not because इससे क्या होगा आप एक बार तो प्रेस कर दिया हम compressions दे रहे हैं रेगुलर दे रहे हैं 100 to 120 per minute दे रहे हैं हम क्यों कर जैसे हार्ट पंप करता है और वो पूरे ब्लड को पंप करेगा तो पीछे से ब्लड आगे आएगा आगे से बॉडी में जाएगा सर्कुलेशन बनेगा so it's very important to actually have continued effort. That's why we say start early. Don't waste time. Start doing CPR as soon as possible. आपको नहीं, if you're not able to tell or detect the carotid pulse, ये वाली
There's a problem with the internet, I think. Yes, Keerat, you want to say something else?
Yeah, ma'am, we actually lost you in the middle. Can you just repeat the last part after the carotid pulse?
If you're not able to tell the pulse, if you're not able to check breathing, just start compressions. Don't waste time, but after calling for help, because you don't want to be in a situation where you could have called for help in time, because emergency services are going to take time to reach as well.
Ma'am, we have one.
What you just said is this. What you are saying is a concept from the time when the defibrillators were not there. It was thought that once we do that, some patients their fibrillation may be set right, but the two are having different purposes. It is not a substitute of CPR, but it can help patients whose arrhythmia has gone wrong, not who is under arrest. The person who's got a cardiac arrest, it may not help. A person who's got ventricular tachycardia and all, it may help in that.
So even in it will be always you can't tell without having monitors and all. And in that emergency situation, we can't so we just have to do compressions.
It is more theoretical than practical.
Yeah, the blow in the center of the chest is more theoretical than practical.
Okay.
Somebody has asked, and I think it's very important, that is it exactly in the middle of the chest or slightly on the left side? No, it is not slightly on the left side. You have to be in the middle of the chest. Because आप left को करते करते जाओगे ना, तो वो आप हो नहीं पाएगा, आपको पता नहीं लगेगा आपको कहाँ जाना है. You will lose track. And it injure sternum. Yes, ribs break भी करते हैं जब CPR किया जाता है. But a broken rib is better than being dead.
Yeah.
So don't be scared. You have to just do the CPR. Slightly to the left is fine. This is also a question. The same person, Mr. Rohan Savlajkar is asking. I'm sorry if I'm not pronouncing your name right. Slightly to the left is fine, but we don't want to confuse people. So I would say कि center तक भी आप चले जाते हो ना अगर towards the lower end, just do it. Don't wait.
It is quite big. So a little bit this side, that side, up, down. It will still be effective.
Right.
Good
Dr.
evening,
Keerat, this awareness week actually they were talking about compression CPR. So do you think that compression CPR is okay to have? I mean, if you don't want to give breathing.
Absolutely, that's the message I want to give here. You're not comfortable. See, I gave you that example that husband, the husband, he had a cardiac arrest. Dr. Sibia knows this patient I'm talking about. He was in Canada. His wife gave CPR and
Dr. Rakesh also knows it.
mouth to mouth. And after some time, the doctor gave the CPR, wife gave mouth to mouth support. So they were comfortable doing that because it was her husband, it was her father, and but if you're randomly meeting someone, you may not be comfortable, and quite understandably so. So what you do is at least keep doing the chest compressions. That in itself can be a major life. That can be enough at times. It's the minimum that one should do. That's what I'm trying to say. ये तो करना ही करना है. Mouth to mouth नहीं करना मत करो. पर ये तो कर ही दो ना. ये तो करना ही करना.
Yeah. And Dr. Keerat, I think there was a question that where to learn it practically. So I think, Mr. Shivdular Singh Dhillon, he'll tell us that all the Red Cross societies, the branches of the Red Cross, they do teach about the CPR practically. So I think we will hear from him.
Thank you, Dr. Rakesh. I must congratulate you and Dr. Sibia and all of you are having put together this session. It's very informative and very useful. In fact, I'll also like to share that post-COVID, there has been a rethink about the mouth-to-mouth resuscitation in CPR, and this year's latest guidelines of the International Red Cross do not recommend mouth-to-mouth resuscitation. It's just the CPR. So those are the latest guidelines that have come in. Having said that, CPR obviously means the difference between life and death, as Dr. Sibia very rightly has said. In fact, the other day, I'll give you an example. A retired Major General and his wife, they just came to my office and they were virtually in tears. And they said that they had attended a first aid training session, including CPR at the Red Cross headquarters in Chandigarh. And the General Saab had a nasty fall and he stopped breathing. And his wife, since both of them had attended this session, she was able to give CPR and bring him back to life. So it was actually a difference between life and death. And these such instances are happening all over the place, all over the world, every day. So this CPR is something that is so simple. As we have already seen, Dr. Sibia gave a very interesting and very nice presentation on that. It's very simple. Anybody and everybody can learn it and everybody can do it. It's a well-known fact that if somebody, due to whatever reason, trauma or whatever, it stops breathing, it has not more than 5 minutes. Because 5 minutes is the difference between life and death without breathing. So immediately CPR has to be given. Of course, one can try for getting the medical help and rush the patient to the hospital. But even in the ambulance, while taking the person to the hospital, CPR must be continued with. That's a must. Because if the distance is more and it takes more than 5-7 minutes, it won't do any good. All that the doctors can probably say if the patient is taken to the hospital and in that condition he'll be brought dead. That will be the verdict. To save him from that, CPR has to be done. And I must say that in all the district branches of the Red Cross Society, we are giving regular trainings. There are regular training sessions on first aid, which include CPR. We're also doing CPR sessions in educational institutions, in schools, colleges, universities. In fact, with some of the universities, we have signed MOUs, Memorandums of Understanding, whereby thousands of students are getting this. And we are doing it for other groups also. One can go online on the Punjab Red Cross site and register oneself for a training. The normal full first aid training is an 8-day thing, just 2 hours a day, is 16 hours total. That gives you everything in first aid, including the CPR. But if one is interested only in CPR, we can always organize a session. Any organization, any institution who are interested, please feel free to get in touch with us. You can get directly in touch with me. You can get in touch with office, wherever. we will be more than happy to provide these sessions anywhere. And the importance cannot be overemphasized. I repeat, the importance of CPR cannot be overemphasized. It can mean the difference between life and death. So thank you very much. It has been a very good session. I must thank the two learned doctors who have, and I'm sure that the book on those nicotine patches is also going to be very, very
Pouches.
useful for
Yeah, it is nicotine pouches
we
actually.
see is a, upcoming epidemic. Thank you very much, and congratulations to all of you for having organized this session. A very useful one, and I'm sure all those who have attended will have benefited from it, and will be much better, informed to react in a situation where any such emergency arises anywhere. And even if one life is saved as a result of this session, I think it is more than worth it. Worth its weight in gold. Thank you very much.
So thank you, sir. Thanks a lot. And do you remember that last year, our Secretary Health, he saved a life. Secretary Health, Chandigarh. He saved a life because he knew about the CPR.
Good evening, sir.
Yes, please.
Sir, to Dr. Keerat, I would like to ask something.
Yes, you may ask. You may ask, please.
You can go ahead, ma'am.
Ma'am, as a medical personnel, we can it is possible for us to maintain a rate of 100 to 120 in a minute, but for a layman person, for the public, it may not be possible. So even if they are not able to maintain the rate, it would be effective, I guess. As you said, no CPR is better than any kind of CPR is better than no CPR.
You're right. You're right.
We have to try to make it as effective as possible. So when you're doing CPR, that's why you have to count it. You have to go like 1, 2, 3, 4. Because if you're not doing that, you will not be able to keep track. And that's the easiest way to actually keep track of the rate of compressions which are being provided. So that's why it is recommended. 1. Number 2, if there are 2 people and one person is doing CPR, वो भी थक जाएगा. After some point, you need
No, ma'am. I just wanted to ask is, like, as a medical personnel, I know the rate. I would be able to maintain the 100 to 120 compressions in a minute. But as a public, somebody who is trying to learn it, and he may need to give compressions to somebody, and he is not able to maintain the rate of 100 to 120, then also it would be effective, right?
Yes, it will help. But the thing is, when that person at least tries to count and take it like 100, 120, वो पता है क्या होगा? At least that person will not reach 120, will reach 90. But if that person is like, oh, I just have to do slowly.
Little faster.
It will be like, it will be, the quality will go much what we want it to be. So we have to at least we have to have a target in mind.
Can I go ahead and add, and can I have little add-on points for that, please?
Yes, please.
Am I audible? Yeah. Actually, as Madam mentioned, Dr. Keerat, that bad CPR is good than not giving a CPR. Yeah, exactly as the participant was asking the question. Madam, nowadays we are trying during a few weeks back, we have seen something called as monk drills, where we try to educate people with respect to CPR. And nowadays, even AED missions are available in all the public places where CPR method of CPR, how to give, is being printed. Even in local trains or even in railways, even in flights, you can see that pictures of the same is being placed. So as a medical professionals, we are supposed to help them in getting knowledge, and Government of India is taking many initiatives to place all the pictures and all at the public places. I hope that will definitely help out people in giving the CPR. And to add on the points with Dr. Keerat, I just wanted to give a small mnemonic people can understand CPR correctly is doctor's CAB. D stands for danger, R stands for
R stands-
response, and S stands for shout for help, and C stands for circulation, A stands for airway, and B stands for breathing. This would be really helpful for all the participants over here. A good mnemonic just to remember is doctor's CAB.
Yeah. Dr. Castro, can you please tell your affiliation?
Pardon?
Dr. Castro, can you just let us know about your affiliation?
Like I'm
I think so. We lost you in the middle. Can you repeat once more?
Or you can put it in the chat box. It's okay. Because your voice is cracking.
Currently working as a professor.
Okay. Okay.
Sure.
Okay.
I'll do. The participant is very clear, and I really appreciate that you have taught us that. Actually, I wasn't knowing the that's for the good knowledge over here, because today when I was doing the awareness program and my
okay,
I think he has dropped out. Ma'am, I actually do have a question for you. I know you've been saying that we need to count. I've heard many a times that you can probably just sing a song to match that rate. Is that true, or does that really not help?
I think that should make sense. For Gana yaad aayega us point.
I don't know, so ma'am, we were actually taught that Staying Alive wala jo gana hai Bee Gees se, that actually matches the rate at which you are supposed to give. So I do not know. I'm just putting out an idea that if
you remember,
you
why
heard
don't you sing it if you remember
So
it?
if that's fast enough, why not? Whatever works for you and keeps you motivated to keep on, because it is exhausting to do a CPR.
Absolutely. So I think this brings.
I think yeah, why not? If that sounds.
So, Dr. Paridhi, I may just make clear about the book. So
Yes,
the book is about the nicotine and chemical form, and not the NRTs. As Mr. Shivdular Singh he said that it is nicotine pouches, it is nicotine patches. So I may make myself clear that it is about the nicotine pouches. So the NRTs and the nicotine pouches are different because they have flavorings with them in them, and the content is also not more than it is always more than 4 milligram. So it may be as high as 63 milligram, which can be very lethal also. So that is the difference between the nicotine pouches and the nicotine patches, nicotine gums, and the nicotine lozenges. Yeah, thank you.
Thank you, sir. So this actually brings us close to today's session. But before we do that, I would like to take a minute to thank Mr. Shivdular Singh, who is, again, like I said, the Secretary of Indian Red Cross Society, the Punjab State Branch, for being the chief guest and giving his chief address. I would also like to thank Dr. Keerat Sibia and Dr. Shivdular Sibia for giving their talk, especially to Dr. Keerat for explaining how we can give a CPR and where we should be giving the CPR. So thank you very much, ma'am, for sharing your expertise on this matter. Last but not the least, Dr. Rakesh, who's from Sipher. Thank you, sir, for organizing this webinar. And thank you to all the lovely participants who joined. I hope you got some information regarding the CPR and you're more confident in providing CPR if any emergency situation arises. With this, I would, so any last comments from your side, Dr. Rakesh, Dr. Sibia?
So I think it's all over. So,
Right.
but I must acknowledge the presence of Mr. Sani and Mr. Buddhi Raja, who is associated with the Punjab Red Cross Society, and anyone else, if I may be leaving. So some of us, our colleagues, they joined actually.
So if you want, we can take one more photograph. I think Dr. Keerat is also here.
Oh yeah. Yes. You can take a photograph.
Yeah.
So please
everyone, please
show
switch on
yourself
your
with good smiles.
cameras. Yeah. and beautiful smiles. All right, on the count of 3, I will take the screenshot. 1, 2, 3. Sorry, just one more. 1,
Yeah.
2, 3. Lovely. Great. So thank you
Thank you.
everyone for joining today's session. Hope you have a lovely evening ahead. Thank you.
Yeah. So thanks a lot. And Dr. Paridhi will be sharing the recording with us.
Yes,
So
sir,
it will
I
be
will.
shared with you all, yeah, day after by day after, it will be with you. So you can just know about, you can just go through it to be more conversant with the CPR. Thank you.
Thank you,
Thank you.
everyone.
Thanks a lot. Thank you.
Thank you, sir. Thank you, ma'am.
Thank
Thank you.